He started it.
Yeah, I think so. Because if she comes in later, she can still go. Okay.
When you're ready to record.
It shows it's recording on yours, right?
It says live.
Yeah, it
Live.
says
Yeah.
live.
Yeah.
Okay.
All right, I guess I'll start.
Okay.
All right, guys. Took me a little bit while to figure out what I wanted to do for this speech. I haven't really done much of my life since I was 19. The only thing I really know is pretty much martial arts. Started at 19 out of high school. I started off with kickboxing, and I did that for a few years. Then I went to boxing. Then I did a little wrestling, and then I saw jiu-jitsu, and they asked me if I wanted to do it. And at first I said no. I'm not getting in between no next guy's legs. That was my whole idea when I saw jiu-jitsu. But a little about jiu-jitsu. I started, I want to say, when I was about 22. Been doing it for about 10 years now. Jiu-jitsu was introduced to Brazil in 1914 by Mitsuyo Miyata from Japan to the Gracie family. The Gracie family improvised and made it their own. That's why it's called Brazilian Jiu-Jitsu instead of Jiu-Jitsu now. It's pretty much a self-defense. They started as a self-defense for the smaller guy, a smaller person to use on a bigger person if they need self-defense. I've been doing it, like I said, for about 10 years now. I'm a black belt. My instructor is from Brazil. There's a few different kinds of jiu-jitsu. The family broke apart over the years, and everybody kind of had their own way of teaching it. So you had one group called Gracie Baja, and then you had another group called Carlson Gracie Jiu-Jitsu, and another one called Gracie Associates. Everybody had their own way of teaching it. So it's kind of broke down in different styles and different formulas. Jiu-jitsu is pretty much, it started off for self-defense, especially for women. You know, you never know you might need it. 95% of fights, you want to say, ends up on the ground. So, you know, it's always good to be able to use it to help defend yourself when you're on the ground. And that's where you got UFC from. Pretty much it started with jiu-jitsu, and they started the mixed martial arts, and it's pretty much evolved pretty much from there. I've been doing, like I said, for 10 years. That's all I really know. That's all I really do with myself. If I'm not home with my kids, I'm usually at the gym training. I haven't done a tournament in a couple years because I missed my thumb up in a tournament. I kind of broke it, and I haven't competed since 2013. But it's been fun. It's been a lot of fun for me. I met a lot of people over the years. It's been good. I met a lot of my close friends are from jiu-jitsu now. Like I said, I don't really do much of myself. If I'm not home, I'm at the gym training. And I consider it's a lifestyle. Jiu-jitsu is a lifestyle. The way you eat, the way you carry yourself, the way you treat people outside of the gym. People cut you off. My coach always says when people cut you off, there's no need to get mad in the street. Just say jiu-jitsu or us. We usually say, if you hear a lot of us jiu-jitsu guys say us a lot, it means pretty much anything. Thank you, yes, no, I see you later. Like I said, it's just a lifestyle. That's all I've been doing since I was 19, pretty much. That's all I really know. Thank you.
Okay. I'll go next. Okay, so for today, I'm going to inform you guys a little bit about dental insurance. It's not that exciting, so I do have a few different pictures to show you. But basically, it's something that you want to know so that you can save a lot of money. A lot of people don't know about their insurance, and I've been dealing with dental insurance for a long time, and I realized that a lot of people don't know their plans at all. So I have a few different steps that will help with choosing or with your benefits. You'll know more about your plan if you have one, and it'll help you find a better one or a good plan if you're looking for one. The first step with the insurance that you need to know is your maximum and deductibles. It's completely different than medical. The deductible toll, it ranges from like $1,000 to $2,000 a year, and that's all they will pay no matter what. So a lot of people get confused because they get like the insurance says they have 2 exams a year or 2 cleanings a year, but they don't mention that you have to have money in your in your maximum, for it to be covered. So there's a lot of little limitations that overlap that people don't know about. So an example, if you came in the beginning of the year for an emergency and you needed to get a tooth extracted or a couple teeth extracted, something major happened and you maxed out your benefits because you only had $1,000. So when you want to come in 6 months for your basic cleaning, which you were told is going to be free from your insurance, it's not covered because you already used all your money in the beginning of the year. So there's that. And then for deductibles with dental, it's like $25 to $100 most, and it's one time a year per person. So it's not thousands of dollars for a deductible like medical. It's one time a year, and it only applies to certain procedures. So you might not ever have to meet it in a year as well. Another thing that people should know is the percentages. There's usually 3 tiers with dental. There's preventative work, basic work, and major work. And they're all in different, all the insurances are different, but usually preventative is 100% or 90% covered. Preventative work is x-rays and exams and cleanings, basically preventing you from needing to get like work done later on. It's a preventative measure. So they're usually covered 100%. So usually you don't have to pay for that. And then basic is usually your fillings. So they'll cover 80% of that usually on average. So you'll pay out of pocket 20%. And the major is the where it's crowns and dentures and bridges. And I have some pictures because I know a lot of people don't know what some of the procedures are. Like they've heard it, but they're not really sure. So this is a picture of a crown. It's basically a cap that's made at a lab. What happens is like a filling gets too big and they can't fill it just with the composite material. So they need to get rid of all of the decay and put a fake cap on top. So that's a crown. And then a bridge is 2 crowns with, basically if you lose a tooth, you're gonna make 2 crowns out of the teeth next to it and then have a fake one in the middle. So that's a bridge. And then there's partial dentures. This is all under major. This is considered like the bigger work. And then partials is like, it's like a denture, but it's not a full denture. It's only for certain like missing teeth. This person's not missing all their teeth. But there's a lot of different rules with the bigger work. With basically this work, the insurance is paying hundreds of dollars, possibly thousands of dollars for this kind of work. So there's a lot more rules to what would be what they allow you to cover and not cover. Like they make it a lot harder for you to get this work covered than a cleaning. The best bet for finding out how much something will cost beforehand, because I know a lot of dental offices, you go there and you get a surprise bill later on or the day when you're there. And getting a pre-authorization is the best thing to do ahead of time. It's basically submitting an insurance claim ahead of time without doing it. So you'll find out exactly what the insurance will pay for the work beforehand. So that's the best bet, because they'll tell you how much money you have left of your max. If you go in the middle of the year and you had work done and you're not sure how much left, it'll factor that as well. So getting a pre-authorization is the best bet. And also a big thing that people should know as a patient at an office is if you're going to in or out of network dentist. The major difference is the fees. Being if you go to a dentist that's out of your network, they can charge you whatever fee they want. And so you end up paying a lot more. If you're in network, the insurance, you have a set contract, like a set fee with them for how much you can charge for certain work. Like, for example, a crown is the dentist charges, an out-of-network dentist charges $1,100. But if you go in network, they charge $800. So it's a big difference between going somewhere that's in and out of network by like hundreds of thousands of dollars, because the insurance restricts you. If you're in network, you can't charge any more than what they're telling you to. So being out of network, and a lot of times a dentist won't tell you that they're out of network. So you have to look for two. Sometimes they'll take more of like your insurance money. So they might not charge you as much, but they'll take more of your maximum of the year. So you might like run out of benefits really quick in the beginning of the year, and later on you're like, where did all the money go? Because it was a simple procedure and you don't really know about it. So those are like the three main points. That was super exciting, but I hope it was a little informative. Just basically, everyone should look more into their insurance or know more about it, because the dental office isn't necessarily going to tell you all of the specifics that your insurance plan has. A big thing as well with major work, like this picture of this person missing this tooth. Some insurance plans have a missing tooth clause is what it's called. It basically means that, say you got this tooth extracted today with one insurance company, and then in a couple of months your employer switched to a different dental. There is a rule that says that you can't, that they're not going to cover for any replacement of it because you had it extracted on a different insurance, which doesn't make any sense at all. And it kind of like screws you, especially if it's your employer that's switching. So it's not your fault that you're switching an insurance company. So they will never pay for something to cover that hole because you switched. So it's a lot of sketchy stuff. But I hope you guys learned something. That's it.
I guess I'll go ahead and go next. Can you guys hear me? You guys hear me all right? Just give me a thumbs up if you can. Right, okay. All right. Have any of you guys ever woke up after a long night of hard drinking and you just felt like absolute death in the morning? I'm talking about the infamous hangover. I've been a victim of the infamous hangover myself, more times I'd like to admit. But I've learned some things. I've learned what to do in order to keep from getting a hangover after a long night. And I'm going to enlighten you today. There's three main steps that you want to consider to avoid getting a hangover. You want to eat. You never want to drink on an empty stomach. You never want to buy cheap liquor, and you always want to stay hydrated. Doing these three things will help you increase your chances of not getting a hangover. Onto the first one. When you drink on an empty stomach, there's an enzyme inside your stomach that metabolizes the alcohol. It's called alcohol dehydrogenase. Now, 85% of the alcohol you drink is metabolized in your liver, but the other 15% is in your stomach. Now, when you have nothing else in your stomach, the alcohol has less time being reactive to the alcohol dehydrogenase, which means it's less effective, so it'll be absorbed straight into your bloodstream. Okay, having food in your stomach also slows the absorption of alcohol in your bloodstream because of the lower concentration. Bigger people tend to have more blood. That's why they take longer to get drunk. Women also tend to get drunker quicker than men because they have half the amount of the alcohol dehydrogenase than men do. And also they typically have more body fat, and that doesn't absorb alcohol very well. So make sure you eat before you go out for a hard night of drinking. The second thing is consume cheap alcohol. And if you have the chance to help this. Spend the extra money. Low quality alcohol has low quality ingredients, and that'll lead to a hangover. And the reason is because alcohol is fermented. Fermentation causes impurities in the alcohol, which they call congeners. Now the body absorbs these congeners and it basically sees them as poisons. And it'll lead to a headache, because a headache is a side effect of your body trying to revert the poison. Also, lower quality alcohols are distilled less than higher quality alcohols are. Now the distillation process is what basically reduces these impurities in the alcohol. So the more alcohol is distilled, the better high quality it'll be and the less chance you have of getting a headache or a hangover. And another thing to consider is dark alcohols always have more congeners than lighter alcohols. So you'll have a better chance of avoiding a hangover if you drink your vodkas or gins, or maybe even some of the lighter tequilas. Another reason that you get hangovers from alcohol is sugar. A lot of mixed drinks will have sugar in the alcohol. And the more sugar you can consume, your blood sugar levels will rise. Now, what happens with that is when you're coming down off that sugar, your body will produce a headache, because you're coming down so hard from basically a sugar high, in a sense. And one thing these things do is cause dehydration, which leads me. Dehydration is the biggest thing. It's the most severe contributor to a hangover. Okay. See, alcohol is a diuretic, which means it makes you go to the bathroom more. You've heard of breaking the seal. That's what people mean when they say break the seal. Once you do it, you keep on going and going, because alcohol makes you want to pee more. Now this dehydrates your body because you're getting rid of any of the fluids that you have in there. It'll dehydrate the brain. Is the tissues in the brain, they're looking for water, so they squeeze together and they contract. And this causes the tissues to squeeze, and that's what gives you the headache in the first place. But also when you drink alcohol, you lose water through all the peeing. You lose electrolytes like potassium and sodium, etc. So what you want to do when you're drinking, if you go out for drinking, you decide to drink, what I like to do is, my rule of thumb is a 2-to-1 ratio. For every 2 drinks you consume, drink a glass of water. And it may be hard to do when you go out, but everywhere you go, there's always water and it's always free. So try to do it if you can, and it'll help you keep you hydrated through the night, and then you won't feel as bad in the morning. These are basically the 3 rules of thumb that you want to consider when trying to avoid a hangover. And I mean, in all reality, the best way to avoid a hangover is to not drink at all. But sometimes, yes. For me, I tend to drink on the weekends with friends socially and whatnot, but I play a lot of sports on the weekends in the morning. So I have to wake up and get up early, and I can't be hungover for any of that. So I try to stick to these 3 rules when I do go drinking, and it helps me to be up and active and not have a hangover in the morning. I've had plenty of practice honing these skills. It's not something to brag about, but I did. That's basically it. That's how you want to avoid a hangover.
Okay, I guess I'll go next. I'm going to be talking about, can you hear me? Okay, I'm going to be talking about natural home remedies for everyday illnesses. Of course, we know that natural herbs can be used for everyday illnesses. It's better than using any prescription drugs that are out there. Also, we find that natural cures or natural herbs are less expensive than prescription drugs, and they're less toxic on the body. Especially when it comes to costs. I mean, especially nowadays, a lot of people don't have insurance. So what better than going out, picking a weed or an herb or whatever from out of the ground, or a spice that's in your kitchen that can be used to treat everyday illnesses that you may have. Some of the basic things, I mean, like I said, with doing natural cures, these herbs, you can plant them yourself. So that beats going to any pharmacy. You don't have to worry about the harmful effects or side effects. You know, when you're just taking a herb that you've grown in your ground and boiling it for tea. And you don't have to worry about the synthetics, the artificial flavoring that's in any of the natural herbs. And I'm aware of this because I have used a lot of these natural remedies. I do know of a friend that actually treated cancer using natural remedies. There was also, of course, changing the diet as well, but they were cured from lung cancer using natural remedies. And this person, and they went using this method because they didn't have insurance, couldn't afford it. They did the surgery, but they didn't do chemo or any radiations. They went to a facility here in West Palm called Hippocrates Health Institute and was treated for cancer. And, you know, he beat it. It lasted for about 5 years, but he went back to eating, because a lot of it has to do with diet as well. He went back to eating, you know, the traditional foods and stuff, and because they actually started out with lung cancer, and then it came back on the voice box, but then they went back to doing the things that they know to do: eat right, take the different herbs, and, you know, with that, again, they were actually cured, you know, from the cancers. And they were being tested and checked along the way while they were going through this process. Like I said, I mean, it comes from simple things such as, you know, peppermint or peppermint oil being used to help headaches or sinuses. You know, it's just as simple as, you know, either putting it on your tongue or actually, or your temple, just using peppermint oil. There's also aloe. Aloe can be used as a laxative. We also have turmeric. Turmeric is a spice that you'll find in your kitchen. Turmeric is used to make the mustard yellow. Using that turmeric can help with inflammation in the body. And it's also a spice that my friend used when they were going through the cancer. You know, only thing they did was took the powdered turmeric, made a paste, and took that a couple of times a day. Then there's also baking soda and lemon juice was another thing that's used for gas. You know, you're talking a teaspoon of baking soda and a couple tablespoons of lemon juice and water. Mix that. It's great for gas. Also, that same remedy was another remedy used for this person that was going through the cancer. Something as simple as baking soda and lemon juice. You know, it wasn't anything that was harsh on the body, and it was very inexpensive. So there are a lot of different remedies that can be used to help just everyday illnesses that we go through in life. And like I said, with a lot of these, like I said, you can grow them yourself, or you can just, they're readily available in the store. So, and that's the great thing about this. I do have a ex-in-law that was a doctor, and, you know, she started noticing that her patients weren't getting well. And so she started looking into natural remedies, which this person is practicing, you know, natural things right now. She was a regular MD. She also had a patient that was going through diabetes, And, she had talked them through to doing natural things, except for this person went on a binge and, he actually ended up dying. So that's when they found out that she wasn't prescribing medicines, because she would tell her clients, I can give you the traditional medicine, or I can tell you what to do with going naturally. So the government actually got on her. They tried to, blame her for his death. But then, while she was in school, she was doing a trial on some medication, and she found out the harmful effects it was doing. And they told her, either you change the information that you found, or she was not going to get a medical license. Well, she changed it. Now, about 3 years ago, she actually lives in Panama right now. The government actually paid her millions of dollars. She can't tell us how much, to keep her quiet for what she knew about whatever this drug was. Of course, it's confidential, so she couldn't tell us that. But because of that, she now cannot come back to the United States. She is on the no-fly zone, and they told her she would be treated as a terrorist. All because, for one, as a doctor, and most, if you don't know it, most doctors will not, well, for one, they can't say they cure, especially if you're doing homeopathic. You're not allowed to say you're going to cure somebody. Government does not like that. Like I said, there are, if we look it up, there's a lot of different, like I said, natural things. I have done a lot. I actually am a 9-year breast cancer survivor. 2 years ago, I had a little scare, but I didn't panic. I just changed and do what I needed to do. I changed my diet, and I just started doing natural things. And, it was very inexpensive, because it was everyday stuff that I could go to the drugstore or the grocery store to buy. The things that I was using, like I said, baking soda and lemon juice being one of them, using other natural vitamins as well. So I would just say, if anybody, going through certain illnesses, it's worth it to look up a natural remedy. For one, like I said, it's cheaper, it's not harmful on the body. And in conclusion, I would say, like I said, there's a lot of research that's been done, that will tell you about using natural remedies, especially for, just basic everyday illnesses, sinus, headaches, even something as simple as a toothache. So it's good. Like I said, try the herbal supplements. It can't hurt. It can only help. And doing that and changing your eating habits, you'll have a healthier and longer life. Thank you.
Okay, can you guys hear me? Can you guys hear me? Yeah, okay, cool. So today I'm going to inform you guys about a mental disorder. So schizophrenia is a serious disorder which affects how people think, act, and feel. Someone with schizophrenia may have difficulty distinguishing what is real and what is imaginary. So that's why they call it a split mind. They may be unresponsive or withdrawn and may have difficulty expressing normal emotions in social situations. This is a mental disorder that affects all 5 senses, but most commonly it manifests as auditory hallucinations, paranoia, and bizarre delusions. I decided to inform you guys about this disorder since I am a psych major, and I wanted to inform you guys of the serious disease instead, because a lot of people make fun of it and call people crazy, but it's actually something very complicated. So schizophrenia affects over 3.2 million Americans every year. Today I'm going to explain the tragic effects of this disorder and the treatments that go with treating somebody with schizophrenia. To begin with, schizophrenia is a complicated disorder that is difficult to understand. In the mental field, psychiatrists believe that schizophrenia may be caused by many factors, one of them being genetics and the other one being the environment. So if you were exposed to certain viral infections before you were born, your chances of getting schizophrenia is very high. It is known that if a parent, a brother, or a sister have schizophrenia, your chances go up by 10%. And if both parents have schizophrenia, your chances go up by 40% of you getting it as well. Symptoms of schizophrenia include positive psychotic symptoms, which are hallucinations such as hearing voices, paranoid delusions, a loss in ability to initiate plans, and confused thinking, problem with attention and concentration. So I actually had a family friend that was diagnosed with schizophrenia, and he would hear voices all the time. It was like multiple people talking to him. So he got treated for it, and although there's no cure for schizophrenia, there's many effective therapies do exist, but none guarantee a permanent end to this specific disease. Antipsychotic drugs is the primary treatment currently for schizophrenia. And this does not cure the disease, but it helps reduce like psychotic episodes, their paranoia, them thinking that people are following them, and hearing the voices inside their heads. Unfortunately, antipsychotic medications often have undesirable side effects. So this causes most of the patients to stop taking their medications. And this is actually very common because they believe that patients with schizophrenia believe that they're getting better once they're taking the medications. So they think that they don't need it anymore. So, and then they get worse again. So it's like an ongoing cycle, and it's very normal for patients to stop taking their medications. I went to a mental hospital, and a lot of people, like they say their patients just come back and forth all the time because like they get better and then they stop and then they come back. So it's very normal to see patients go back and forth at mental hospitals. As you can see, this is a serious chronic brain disorder. It's out of the DSM-5, which is the book of all brain disorders for psychology. It is the most serious one. That it calls it a split mind because you don't know how to differentiate what is real and what is imaginary to you. So many people suffer from this, and victims don't have much control over it. Today, I have informed you of the causes of this and how to treat schizophrenia. That's it. I'm done.
Okay.
Okay, that's all we got, right?
Yep.
Yeah.
Keeps getting smaller and smaller. Okay. So I'll stop the broadcast, and then it should post. It'll take a couple minutes, and then I'll send the link into the group.
Okay.
I think that's
Okay.
what we